you doing? This is Jim Fisher, the third way, not left, not right, but America's third way, libertarianism. Today I wanted to do part 2 of healthcare, Obamacare. The first thing I wanted to talk about is, the lies that Obama told us when he was campaigning for Obamacare. The first thing he said to us was, if you like your doctor, you can keep your doctor. If you like your plan, you can keep your plan. He told us that over and over. That's actually a lie. Well, I guess in a way it's not a lie. Technically, that's true. You can keep your plan if you like your plan. You can keep your doctor if you like your doctor. Once your plan makes a qualified change under the bill, they now have to comply with everything in the 2,000-page regulation. So once a qualified change can be an increase in your co-payment, it can be an increase in your insurance premium that you pay. Any type of change they make that's considered a qualified change will now force you to comply, your insurer to comply with everything under the bill, which means they're going to have to provide psychiatric care, cover your children until they're 26 years old, all kinds of things that increase the cost for your insurance company. And guess what? If your insurance company has increased costs, they don't just go, okay, we're not going to make a profit anymore, that's cool. They increase the cost, their increased costs get passed on to you, and you're going to have to pay more for your insurance. So this whole idea that Obamacare is going to save $2,500 for the average family in premiums is a farce. The Congressional Budget Office now says it will actually increase about $2,100 per family. The other thing that Obama has done since the bill's passed, and it's not even completely in until about 2013, is he's already given 1,000 waivers. These are waivers to unions. The same unions that supported passing this bill have asked for a waiver from the bill. And the reason he's given these waivers, the first company to ask for a waiver was McDonald's. McDonald's offers their employee a different type of insurance plan. They don't make a lot of money per employee, so they can't offer a comprehensive insurance plan like a lot of us get. They offer them a more very high deductible, low cost insurance plan. These type of plans, because companies like McDonald's have very high turnover, and that because of the nature of the plan itself, they have very high administrative costs. The law, the Obamacare, says that you cannot have more than 10% administrative costs. Think about that for a minute. They made a law not to have more than 10% administrative costs. Like, a company wants to have more than 10% of administrative costs. Like, they were just sitting around going, oh, what do we do? This sucks. Oh, look, the bill says don't spend more than 10% on administrative costs. Let's not do that anymore, and we'll save money. If they could have done it, they would have done it. And so they can't do it, and they know they can't do it, and it's obvious they can't do it, which is why they were given a waiver. It's absolutely ridiculous, the logic behind that. Like, you can tell somebody, it'd be like you're somebody passing a law and saying, spend less on food every week. Oh, really? Oh, now that it's a law, I'll do it. I wasn't going to do it all along. I was going to just keep wasting money. But now that you said so, okay. That's the logic of bureaucrats in Washington. If you look in Massachusetts, our insurance premiums are actually accelerating past the national average, 33%. Our healthcare costs are rising more than 33%, are rising 33% higher than the rest of the country. In Boston alone, we have twice the wait times for specialists than the next highest metropolitan area has. So, Obamacare isn't working that great in Massachusetts, and this is kind of what Obamacare has been modeled after. Not exactly, but it's actually way worse than Romneycare, way more extensive, but that's kind of where it got its origins. And in Massachusetts, we still have 5.5% of our population not covered by insurance because people are choosing to pay the $800 fine rather than cover themselves because they can't afford to do it. Just because you pass a law that says you have to buy insurance doesn't make insurance any cheaper, doesn't make it any easier. All you did is these poor folks that couldn't buy insurance before now pay an $800 fine at the end of the year. Think about that. Yeah, that's really helping them out, help out the poor uninsured people by making them pay an $800 fine at the end of the year. The logic of that, it escapes me. But this is all bureaucracy can do. That's enough for the moment. I have a lot more to say about Obamacare. This is a catastrophic plan. We haven't even got into the $2.6 trillion it's going to cost us over the next 10 years, even though they claimed it would be better than budget neutral, that it was actually going to help us with our deficit spending. That's like absolutely ridiculous. That they claimed it's going to help the economy. How can forcing companies to spend more money help the economy? That's absolutely ridiculous. Just think about it on a logical level, on a statistical logical level. Medicare has an unfunded liability of $38 trillion in the future. That means there's $38 trillion projected in the future that we do not predict to take in through tax revenue. It's insanity. And that's what bureaucracy does with anything, let alone healthcare. We're going to let them manage something as complex as healthcare. It's insanity. So that's enough for now. Jim Fisher, the Third Way. Not left, not right, but America's Third Way.